The goal of research is to help us to understand whether or not medications are safe, whether or not they're efficacious, how feasible it is for people to tolerate different medications. And so research helps to inform how we set up the sort of guidelines that we give to people about how and when to use cannabis products. And so research is really critical for helping us to make sure that the products that people are using do what they're intended to do, and that we understand what are some of the drawbacks potentially, what are the side effects, and how we might better need to address those issues. We want to know how people are utilizing these products in real life. The timing, the dosage, the forms, all of these questions I think are really critical to helping us to help people manage just the volume of options that are out there. I remember a few years back hearing how there were over 50,000 different cannabis products that were available for sale in the state of California alone. That is an overwhelming amount of choice. And empirically, that's going to be extremely challenging to do rigorous testing of all of those different forms of cannabis. And so I think that there does need to be a lot more safe and efficacious trials to help us to understand how and when cannabis can be used. I think that the problem with anecdotal stories is that tells you the story of what it's like to be that one person. And research helps us to develop more generalizable results. And this is really important because cannabinoids are not just one chemical. There are hundreds. There are over 100 cannabinoids out there. And so people have different metabolisms, different enzymes for breaking down the cannabis products. They have different responses to, say, an inhaled product or a topical product or an edible product. And so there's so much between person heterogeneity of how people process cannabis that it would be extremely challenging for us to say that one person's experience would translate to everybody else's experience. So anecdotal evidence can be a learning point potentially, or useful, but in the sense of like as people are trying to have a starting point. But generalizable research evidence is the gold standard for how do we make sure that we're really understanding how do people and in which subpopulations might best respond to various products, or not. Doing research helps to provide the pharmacists with more empirical evidence that they can use to help guide patients through the product selection process, how to avoid potential side effects, and how to optimally consider how to treat their condition, which may not be just one condition, but might be multiple conditions, and how it might interact with other medications. There's a lot of medical complexity to how people are using cannabis, and it's really important that we have as much evidence as possible to help inform those conversations, which might be very nuanced for people who are managing a lot of complex comorbid conditions.